really, I think of REI or reproductive endocrinology as kind of amped up GYN in many ways, right? It's all about how our hormones have this interplay and are so complex. They touch upon every organ in our body. And I enjoyed getting to know all of the pathways and intricacies and delving into that with patients and helping educate them. So that's part of the reason I ended up doing REI. And so that was the beginning of my journey, Julie.
Hello, and welcome to Pursuing Health. I'm Dr. Julie Fouché, family physician and former CrossFit Games athlete. Here, I bring you information and inspiration to help bridge the gap between fitness and medicine and support your journey toward your healthiest self. Thank you so much for joining me. Now let's get started with this week's episode. Welcome back to Pursuing Health. I am very excited to be here today with Dr. Lauren Rubal, who is a USC-trained Reproductive Endocrinology and Infertility MD. And I love how she defines her greatest career achievement as leaving a traditional REI partnership to pursue a radically reimagined vision for reproductive care. And I'm excited to talk to her about that today. She currently owns a boutique practice in Orange County, California, and her mission is to identify the root cause and heal reproductive issues holistically. Her unique approach focuses on fertility, recurrent miscarriage, painful, irregular, or heavy cycles, and menopause using an integrative lens. She's double board certified in Integrative Medicine and OB/GYN. She's also a wife, a mom to 3 boys, and she loves spending time in nature. So welcome to the podcast. I'm so excited to connect with you here, Lauren.
Yes, thank you for having me, Julie. I'm excited to speak.
Yes. And I actually was introduced to you because I was looking at the upcoming FACS virtual conference where you are going to be speaking. And for those who are listening who aren't familiar or don't remember, FACS is a group dedicated to providing information about natural or fertility awareness-based methods of family planning to the medical community. So it was a group I was introduced to as a med student and as a resident. The founder, Dr. Marguerite Duane, has been on the podcast in the past, talking about this topic as well, which was a great episode. So if you want some background, I highly recommend going back to check that one out. But I'm excited that you're going to be speaking. And as soon as I learned about you and looked you up, I said, oh my gosh, I really want to talk to you and learn from you all about this topic. So maybe we can just start at the beginning, a little bit about your story and how you got to where you are and what led you in the first place to deciding to become a doctor, and then how you chose OB/GYN and then REI.
Oh, yeah, absolutely. I probably feel like I'm amongst the majority of us who may have always known we wanted to help people, right? Mm-hmm. And so I was one of those. I knew since I was little that I wanted to be a doctor. I thought I wanted to be a pediatrician, actually. I think probably because I was a kid when I first decided. Perhaps
sure. Those are the doctors you see most of the time.
Right, that's true, right? Exactly. And love kids which is nice because I'm still getting to help with that process in my job today. But, was lucky enough to go to a program where I was accepted into medical school from high school. And so was able to really hone in on that passion and that love. Went to medical school at University of Miami and then continued on from college to medical school there. And then during the course of med school, I don't know, in 3rd year, which is when we do our rotations, I realized how much of an affinity I had for surgery and for procedures. And it was really a very surprising discovery. I did not anticipate that. And so fell in love with the field of OB/GYN because it's a beautiful mix of both medicine, of continuity, of getting to know your patients, but also of really a very full day comprised of both, again, working with my hands as well as sitting and developing these relationships and guiding people through very serious issues at times, right? So the highest of highs, the lowest of lows. And so fell in love with the field and then went out, did my OB/GYN residency. And again, it was very much a joy to have all parts of it, right? Delivering babies, the surgeries, but again, had quite a heart for those couples who were having difficulty conceiving and Really, I think of REI or reproductive endocrinology as kind of amped up GYN in many ways, right? It's all about how our hormones have this interplay and are so complex. They touch upon every organ in our body. And I enjoyed getting to know all of the pathways and intricacies and delving into that with patients and helping educate them. So that's part of the reason I ended up doing REI. And so that was the beginning of my journey, Julie. But I'll tell you, I practiced as a very conventional REI for a bit. And in that time, I just felt more and more that I was so focused on these seemingly disparate organs, and I wasn't making those connections of how interrelated we are, and that we're more than our physical compartments anyway, that we're composed of souls. We have our mental state, our emotions. All of this plays so much into wellness and health. And so for many, many reasons, I just felt like I wasn't providing the care that I always thought I wanted to. And I decided to just leave my partnership. I opened my practice and did my Integrative Medicine Fellowship. And I know we have that similar story because we both went to the University of Arizona for that 2-year fellowship, which was life-changing. It finally put me with the tools that I needed to be able to make a difference for my patients in a way that was so fulfilling and is so fulfilling.
Amazing. Oh my gosh, there's so much to unpack here. I think on the one hand, I can relate a lot with this feeling of even growing up knowing, okay, I want to help people or I want to be a doctor. I feel like I tried everything else to convince myself that maybe I could do something else before I finally committed and applied to med school. And because I couldn't shake it, right? It was like, that was the only thing I knew I wanted to do. And interestingly, I was on the opposite end where I thought family medicine was the last thing I would do. I was like, oh, it's so boring and so broad. I want to be a super specialist, or I thought about being a surgeon. And then I went the other direction. I was like, once I got into med school and I realized how much I wanted to be on the preventive side of things and like you mentioned with OBGYN, if I hadn't done family medicine, I definitely would have done OBGYN just because of the longitudinal relationships you get to have and being there for your patients during these really important times in life. Like you said, the highs and lows. But then, like you said, I can also relate to, okay, realizing that the system is really built and geared towards treating these really disparate body parts and organ systems instead of looking at the body as a whole, and often jumping straight to pills or procedures as the main treatment, right? And I think in an IVF focused practice, so many women, you sort of reach that 12, okay, it's been 12 months, I've been trying, what do I do next? It's like often it feels like IVF is the next option, and there's not a lot of other investigation into, okay, well, why are you experiencing infertility, or what could the root causes be, and how much you then can explore that using an integrative approach. And I will clarify, I didn't do the full 2-year fellowship. I did the program during residency, so it was not quite as extensive, but I got some exposure to it and exposure to functional medicine. And it just seems like such an incredible program. But I'm curious for you, I'm always curious about what leads people to change their perspective or for their eyes to be opened. It's like once you see it, you're like, I can't unsee it. And I know I need to practice in a way that's more in integrity with my own values. But what was it for you that helped you to kind of say, okay, this is not the way, maybe there's another way. Maybe that there's a better way that I can be helping patients, and start exploring those other options like integrated medicine?
Yes, I think there were, multiple factors to this. But first of all, it was just this nagging feeling that I wasn't looking at root causes, that I was putting those fancy Band-Aids. And I think part of that was how much I was prescribing birth control pills, quite frankly. I was prescribing for heavy periods, light periods, too few periods, too many periods, for acne. And it just felt like this can't really be the only tool in our armamentarium. Like there's something that's causing these signs. And I didn't feel, I speak for myself, I felt like I'm not doing my due diligence. Like I want to explore that more and understand the why, because putting them on this intervention, I know that it's not going to heal them in any way. That as soon as they go off, they're going to have continued issues on top of the side effects and risks that using this pharmaceutical is going to bring, right? Mm-hmm. And so I just, again, it was that nagging feeling in that regard. It was the feeling that so much of the time I was saying this diagnosis of unexplained infertility, which is what we give this diagnosis when a woman is ovulating, has at least a tube open, has sperm, there's sperm. But I felt like up to a third of patients, according to some accounts, may have this diagnosis. Certainly 11% of the time, this is the reason why couples choose to go to IVF, with another about 25% of those couples because of an other fertility factor, which may be in some ways unexplained, right? And I just felt like, goodness, that is a huge proportion of patients where there may be something that we can correct to help with their overall health, help them during the pregnancy, and then potentially have an impact on helping baby. So that part of it really became more and more pronounced as I was practicing. And I also think as I was practicing the nuts and bolts of my day-to-day life as, again, a conventional REI, I felt like with IVF, very much that it was not the panacea that everyone thinks of it as, that there were significant issues in regards to the procedure itself, and that I wasn't educated enough on the alternatives. And so it really inspired me to look at restorative reproductive medicine. I was blown away once I did. It was, as I say, talking to others, that I was the purported expert, and I had no idea the amount of data and the tools that are present that really can help women empower themselves to understand their body and to optimize their fertility and wellness. I mean, the menstrual cycle is the sixth vital sign. It truly is. It tells us a lot about what's going on. We just have to know how to look for it. And so I'm really passionate about education for people, for teens, for physicians, right? I think that that's the way we make a change. And I think there's a lot of good that can be done. So I'm excited that you are leading the charge here. And I think that's what we need to keep doing is just telling the world there's another way. So that was a lot of it.
Yeah. And it takes so much courage to do that, I think. But like once, to say, okay, there's another way. I'm going to go out and start my own thing, which is a little scary. And I think you did it. It looked like maybe right before the pandemic or right around, which makes it even scarier.
Well, I had no idea. It actually worked out very perfectly, quite frankly. Yeah, it happened right before the pandemic, but then it was such a blessing. So it's actually so providential that it happened at that time. But yes, there was a lot of uncertainty at the beginning of this new practice. Yes. Definitely. So yeah, but I think that was also, again,
all part of the plan.
It was all part of the plan. That's exactly right.
Yes, that's great. But right, you hit on a point that in medical school, we really don't get a lot of education. I mean, on any kind of root cause lifestyle related, when we're talking about any kind of chronic disease, there's such little emphasis on things like nutrition and the power of exercise, or even toxins in our environment that we get education on. And, when we're learning about birth control methods, I will never forget the day where in my medical school where it was like, learn about birth control day. And that you go around this table and you learn about each of the different methods, and the fertility awareness-based methods, I think were not even mentioned, or they were like, oh, well, there's this, but they don't work and nobody uses them. So like moving on, it's not even really given adequate education because there is a lot of efficacy and research out there about them. And so I think it's, and now I think women are asking the questions and doing the research on their own, which is really cool to see, which is making doctors have to also learn more. But I would love to.
I'm always about that. Like, be your own best advocate, always. Yeah.
Right. But I'd love for you to just compare for us, because you mentioned restorative reproductive medicine, to tell us a little bit about what that is. And then just compare for us the two approaches of, like, say a woman is diagnosed with infertility. What would the process look like if she goes towards the IVF route, or if she goes the restorative reproductive medicine route?
So, yes, great question. So in terms of the differences, I'll start with IVF. In IVF, essentially the goal is to wrest control of that woman's ovulatory cycle. Where in the normal ovulatory cycle, what is happening is there's actually a group of follicles, all containing eggs, racing, madly racing to be that one that wins the race, that gets ovulated and released, and then potentially can combine with sperm to make a baby. And so it's very much a finely tuned process with hormones coming from the brain and interacting with the hormones being produced from the ovaries as well, amongst other hormones that are all playing a role. And so you contrast that to the process of IVF, where the way I kind of describe it is that everyone's a winner in the sense that the physician in some ways becomes the exogenous brain, that we give fertility medications that are similar to the ones that our brain normally produces. We override the system, if you will. We have all of those racers for that month grow and mature and yield mature eggs. And then instead of letting them be released, as would normally happen, there's a procedure that's done where those eggs are pulled out from the body using a needle through the vagina into each of those follicles and suctioning out each of those eggs in both ovaries under ultrasound guidance. Okay, so that's the egg harvesting or egg retrieval. And then those eggs are taken to an embryologist. That embryologist will then choose a sperm and either place that sperm and inject it directly into the egg or put that egg into a dish with multiple sperm. And we see what embryos are formed. Those embryos then grow in those dishes over a period of days. And then they have one of three fates. They're either transferred back into that woman's uterus or another woman's uterus. They're frozen, potentially indefinitely, or they're biopsied. So there's cells that are removed from that embryo and tested, screened to see if those chromosomes are deemed normal. And if they are, then those would be potentially transferred back. If they aren't, many times those embryos are destroyed. And so that's the IVF process, okay? But you can see that there's a lot of, it's very much controlled by external factors, okay? Contrast that to restorative reproductive medicine. What is that? Essentially what that is for that woman, it's a very personalized look at how is her, what are the factors affecting her fertility? A deep dive into her hormones, into how her ovulation is going. How is her egg quality and cellular health in general? Is there anything happening at the level of the microbiome of the tubes or uterus? And then, of course, looking at the sperm and how to optimize that. And we really, I'll look at different hormone levels. I'll look at inflammatory markers, vitamins. We really, different nutrients. And we really build a plan to try to restore optimal fertility for that woman naturally so that she can conceive ideally on her own, with minimal intervention. So that's in some ways a very broad way of looking at the difference. I don't know if that answers that question.
Absolutely. It's this idea of, okay, looking at the woman holistically and trying to maximize her own health and fertility, hopefully then allow a pregnancy to happen naturally, versus intervening with a procedure, which also you would like to think that even if, you do all those things and you still aren't getting pregnant naturally and you do go forward with a procedure, hopefully the procedure would be more effective and more likely to work well if your body is in a healthier state anyway. So it seems sort of like a no-brainer to at least start there and try to address root causes. But I know I've heard you mention a study before where they compared this method, or they used this method in women who had already failed IVF a couple of times or had one or two failed IVF treatments, and actually showed that it had a pretty great response for women who had already had unsuccessful IVF attempts.
Yes,
which is pretty incredible.
I mean, there's data to support that. That's right, Julie. I mean, first of all, I think what's very compelling is that there's multiple different methods within that restorative reproductive medicine umbrella. And so one of them is NAPRO technology. There's FEMM, there's neofertility. There's others, symptothermal billings. All of these use different signs of a woman's body. So that's the fertility awareness-based methods.
Okay.
That in order we're able to deduce what, if any, hormone imbalances or other structural factors are at play that might be affecting her fertility. Got it? And so a really interesting study showed that in a cohort of couples presenting to a NAPRO technology practice, about 50% of those couples had a diagnosis of unexplained upon presentation. And after the full evaluation, less than 1% of those couples had that diagnosis. They had, yes, which is just very pronounced of a difference, clearly. And then the study that you're referring to is from Dr. Phil Boyle, who is a neofertility specialist, and he was amazingly able to achieve comparable pregnancy rates in what we call a poor prognosis group of patients. Those are couples who the female partner was older, who had they had 5 years on average of infertility. They had all failed or had all undergone, I should say, prior IVF cycles, 95% of whom had not achieved pregnancy with them, with the average number of cycles is 2 prior. And so by all intents and purposes, this was a group of patients who would not have had a high pregnancy rate, and yet he was able to accomplish that. So I think that the data which is present is quite compelling. Yes, absolutely.
Right. And it just makes logical sense, right? That, if we can restore health as much as possible and your body's in a healthy state, it's more likely to be able to achieve a pregnancy and carry a pregnancy. And especially thinking about going into something like IVF, which can be very costly and time and, the emotional toll that it can take to, I would be so curious if they would do a study, maybe they're already working on it, where women go through a NAPRO approach or this approach first, and then how many of them actually end up needing to go forward with IVF, and then how many are successful with IVF, once they've done this approach first. It would be very interesting to see.
Yeah, I'm not aware of a study being done that is similar to that. That would be interesting. But I think that, and again, I'm biased because I see women who are seeking out help for hormone imbalances, right? But I will tell you, the vast majority of all women I see have at least one of the risks or issues that you were alluding to earlier, whether it be exposure to different toxins in our environment through our food, through all the products, right? All the things, it feels like in some ways. And we know that those are mimickers of our hormones, some of these chemicals, whether it be through just changes and issues with their microbiome. I mean, so many of us have gut issues, it feels like, that absolutely have a role in other factors, including our immune system, right? Or whether it just be those hormone imbalances from stressors like hypothalamic insufficiency or thyroid issues, imbalance in female hormones. There's a lot out there that I'm seeing with my patients just on a day-to-day basis that we can help with and we can heal. So I think there's hope for people listening. And there is a way forward, again, that doesn't have to be the most aggressive path. It doesn't mean that it's not difficult, because you have to change your lifestyle in many ways. Right. And that is a daily process. And, I tell everyone, don't be enslaved to the diet or to that regimen. We have to be able to live our life. But at the same time, it's amazing what people can do when they empower themselves to do it. Right.
Very powerful. Yes. And I think you're so right. Bringing that point up is that we can also very easily go the other way, where we can create more stress for ourselves if we become so obsessed about being perfect in all these areas. And then that impact on our stress response also can negatively impact our health. So there is a balance with this, right? And, but it is all so powerful. So I'd love to shift and talk a little bit about that. Let's say you're talking to a woman who, whether she's experiencing infertility or she's just thinking, maybe in the next 3 to 6 months, I'm thinking about trying to get pregnant. What are the different things that we should be thinking about in order to optimize our health and our fertility? You mentioned a few of them already, but what are some of the places to start?
Yes. And so I think about this in regards to different lifestyle factors. So really those integrative medicine pillars, right? And then I think about more of the hormones and how they interrelate. So we start with lifestyle because those are so foundational. And those, again, we can make small changes to have these profound impacts, right? And so for women who are hoping to achieve pregnancy, there's actually data showing that physical activity and the amount of physical activity may make a difference in time to conception. Okay. I mean, with that being said, I think it's really important to be able to move our body every day, to have that be an outlet. It's really important emotionally, mentally, and also just for our health and wellness. But the type of exercise that we choose and the intensity, the duration may be modulated depending on a few factors. Okay. And so what the data show is that if a woman is overweight, so it was classified as a body mass index greater than 25. I know that there are, maybe some issues with the characterization of weight in regards, or overweight status in regards to that. But for these purposes, what they said was, if a woman's overweight, any type of exercise, any intensity shortens time to conception. For women that are underweight or normal weight, actually, in that case, then perhaps a more moderate or mild intensity exercise regimen may be optimal for those women. Okay. And so I think that can be tied together with the nutritional piece, which again is something else quite important as a woman's thinking about her fertility. There's a pro-fertility diet, which exists per the literature. And it seems like there's multiple different ones. Of course, Mediterranean diet is always, the best. It seems like for everything, right? So, yes. But so what it is comprised of, this pro-fertility diet, is just a protein and a focus on ideally organic, of course, grass-fed, really protein sources that are not being exposed to antibiotics or pesticides, or maybe some of these feeds that we're then getting in our bodies, right? It's comprised of a good amount of antioxidants from vegetables and fruit. It's actually comprised of full fats. And that makes sense because fat and cholesterol is the building block of our hormones. So we need to have that building block in order to have sufficient production. And it's comprised of other anti-inflammatory products, like olive oils is one that I tell my patients, big proponent of that, but those polyphenols, right? And so that is a pro-fertility diet that I also tell people that the type of and the pattern of what they're eating and how they're eating it. So maybe this isn't the time for intermittent fasting. Like, we want to just really kind of support and prepare for pregnancy. And those type of restrictive diets are not ideal when you're pregnant, certainly. Okay. So we think about those type of factors. Okay. Obviously, I think if a woman's dealing with gut issues, this is a time to consider doing elimination diets, or trying to really dive deep and figure that out, heal her gut, understand if there's anything that she has an intolerance to. It's a nice time to do so, to prepare her body as well. Okay. And then I think of other lifestyle pillars. So of course, we talk about stress, and I feel like stress is so hard because stress is out. There are stressors in our lives.
It's unavoidable.
It's unavoidable, right? But what's in our control, and what I like to tell people, is that we have the opportunity every day to find something that you find fulfilling, that brings you peace, and to try to make sure you focus on that, whether that be prayer, time in nature, right? Exercise again, journaling. It's so personal. But each of us has something that really brings us joy. And I just want us to make time in our lives for that, because life gets so busy. That's usually the first thing that flies out the window, unfortunately, right? And so those are a few of those foundational impacts. In terms of other integrative medicine modalities, of course, it's decreasing our toxin burden by just trying to make small shifts. I'm sure you've had other guests on who have really delved into this, but I tell people, if we can, just try to avoid pesticides through eating organic, right? These small changes that a lot of us are able to do, are changing the type of endocrine disrupting chemicals we're exposed to, be it through our fragrances or different body care products. It also includes just really considering some supplementation if people are open to this and depending on their circumstances. So having a good prenatal vitamin and starting to take that. There are studies that show that adequate folic acid levels actually optimize fertility and decrease risk of birth defects in baby if they're taken for about 3 months prior to getting pregnant. That's one example. Omega-3s are, again, wonderful anti-inflammatories and antioxidants that have multiple benefits for mom and for babies. And so those are just a couple. And then the final one I would say is consideration of a probiotic, or really honing in on whether your microbiome and its different compartments are balanced. And if not, again, doing that work to get that balance as much as possible. So those are some of the integrative medicine parts. And I can speak to the hormones too, because that's a whole different part.
Absolutely. Yeah, I would love to go there. I think I loved all the points that you made. And I think specifically you mentioned 3 months, like thinking about being on a prenatal at least 3 months before. Can you talk a little bit about that? Like just the timeline of how our eggs are recruited, and, if you're thinking about getting pregnant, when should you really start, dialing some of these things in? If you're kind of saying like, oh, I'll do that once I'm ready for pregnancy. When's the time to start?
That's a great question. I would say that I am, of course, again, biased, but I would love people to do as much to even say, we're just going to do the basic foundational changes with nutrition and eating a balanced diet with, with the physical activity, with sleep and trying to work on sleep as soon as you can. I think that that's just great for our wellness and longevity. So that's my
you
side.
would love everyone to do that all the time.
Yes. I get it, right? Exactly. But so in terms of your question about the eggs, it's interesting because our eggs actually begin developing a few months prior to that race I was talking about, where they line up and then they go on that race to see who's going to be released from the ovary. And so certainly the data show that if you can start those practices a few months prior to saying I'm ready to conceive, it's wonderful, because you'll already be having your eggs starting to kind of bathe in that new follicular fluid, if you will, or all those changes that might be undergoing. The same goes for sperm, actually. So it seems to be about a few months, but after which there's a new crop of sperm that develops. Okay. And so I would encourage both men and women to be making those shifts 3 or so months prior to their starting to try to conceive about.
I love that. And then you mentioned, as far as toxins, thinking about, the toxins in our food, trying to eat organic when you can, the quality of your meat, the looking at personal care products, home cleaning products, things like that. What about for women, things like hair dye, getting your nails done, spray tans, all of these things that come up? Are those also things that can impact egg quality? I know some of them are often, talked about during pregnancy, but what about preconception?
Yeah, great question. This is where I start feeling like, again, I want people to remember that they have to live in the here and now, right? And so we are always wanting to do our best and optimize our health. Again, the longevity, we've already talked about that.
Right.
At the same time, if that's something where they feel like, once in a while, I want to do X, Y, and Z, I think we have to also live our lives, okay? With those things being said, I think that there's less data to guide us in terms of egg quality in regards to those different factors. I will tell you that I am of the opinion that if we can be purists in some ways, I think that it just makes the most sense if possible. If not, then things like dyes, or even for nail polish, I would try to use the least harsh chemicals possible. I would try to also, this is probably an unpopular opinion, but maybe avoid gels. And that's because of the UV and the light exposure to our skin. Quite frankly, again, not good data. This is just if we want to be purists, that's what I would encourage people to do.
So interesting. Okay, got it. So live your life, but as naturally as possible.
Yes.
I love that. What about, you mentioned a couple of supplements. You mentioned the prenatal vitamin, the folate, the omegas. What about choline? I know that choline you can get through foods. It's really high in eggs, but what do you recommend for women? Is that more, once they're pregnant, or is that something they should think about ahead of time as well?
Yeah, great question. Choline's an essential nutrient that, yes, you can get in eggs or in meat. A lot of people are not consuming those in enough quantity to have sufficient choline levels. It's essential for baby and for baby's brain development as well.
Mm-hmm.
So I certainly encourage women to either opt to do it through their diet and just be on top of how much they're consuming, or to take a prenatal that does have sufficient choline. I will say that, as you know, Julie, I'm sure part of what we learned in our fellowship is that there is such a breadth of differences and variances between different supplements, right? And certainly between different vitamins and multivitamins. And this is one that is precisely one where there is a large variance from brand to brand. Mm-hmm. So I would encourage people to look for a brand that has at least over 100 milligrams of choline, or even over 200 would be sufficient. Again, depending on the factors of how much they're intaking from their diet. A lot of brands have a very low amount still. So yes, but it is important as well.
Yes. And great point, right? There's so much marketing out there, right? To read labels, understand how much of the nutrient is in the vitamin, what form, and the quality of the supplement. Has it been third-party tested? All of those things are really important. So are there any other supplements that you recommend frequently for egg quality, or for women who are, or looking for, detoxification support as they're thinking about removing these toxins?
Yes. So in terms of egg quality, I really love a few supplements, but I think it also speaks to the importance of health at a cellular level, right? And so we want to minimize free radical damage, and we can do that in some ways, obviously through the choices we're making and what we're getting exposed to, but as well we can do that through antioxidant supplementation potentially, right? And the same thing goes for inflammation. We can help our body's inflammatory burden choices as well as potentially supplementation. And so I think that the classic one to help with egg quality is coenzyme Q10. And so the form that I like is ubiquinol, that seems to be absorbed better. But this is a mitochondrial cofactor. And as you know, those mitochondria are the energy powerhouses of our cells. And so believe it or not, the egg has a huge amount of mitochondria, and that amount increases 10 times over the course of the egg's life, because as that egg matures and grows, its mitochondria are increasing to keep up with that. Not only that, the egg, the embryo gets all of its mitochondria from egg. And so it becomes very important for us as women to try to optimize our mitochondria as much as possible. And CoQ10 may be one of those measures which can help us. And this has been shown in multiple animal studies in terms of improvements in egg and embryo quality. But there's also some studies in humans that suggest that there's improvements when women are taking coenzyme Q10. Again, typically it'll depend on the person. You can test CoQ10 levels. Of course, I love the tailored approach as much as possible. However, I would say for a lot of women, about 200 milligrams twice daily, more or less, it kind of varies depending on that person, is a great starting dose to help with that. I would say that it's best taken with food because fat improves absorption. And I also encourage people to take it on the earlier side of the day, because if it's taken too late at night, it can be associated with insomnia or issues with sleep. So, so that's one kind of classic one that I think is well tolerated, has obvious benefit, and actually is useful for other conditions. As you know, it can be useful for heart health, for our sugar homeostasis as well. Another supplement that I love for benefits potentially in egg quality includes alpha lipoic acid. This is an anti-inflammatory and antioxidant. It, again, is very helpful potentially in sugar homeostasis as well. But this one is another one that there might be an association with improvements in egg quality in women. And so for this one, I'll typically use the R isomer, and I'll use about 200 to 300 milligrams daily, again, depending on what's going on with that patient. And then finally, I will many times be using N-acetylcysteine or glutathione in a lot of my patients, because N-acetylcysteine is the precursor to glutathione, which is the most potent antioxidant in the body. And that's important, obviously, for all our cells, including our eggs. And there's a wealth of research actually looking at N-acetylcysteine in regards to several hormone-dependent and fertility impacting conditions, including polycystic ovary syndrome and endometriosis. It's beneficial potentially even in certain infectious conditions. So I think it's a wonderful one that people tolerate really well. And the dose for that one, again, can range, but seems to be for some of those conditions, 600 milligrams 3 times a day for NAC in particular.
Wonderful. Mm-hmm. Wonderful. Well, that is all extremely helpful. And I love how you offer just such specifics too, even around dosing and quality, because so many times women hear names of supplements and then don't know, okay, well, how much do I take? And again, of course, you want to be talking to your own physician and ideally personalizing this based on your situation versus just going out there and taking a bunch of supplements without understanding the impact on your own body. So amazing. Anything else that we should talk about as far as just optimizing fertility? I know we talked about a lot of different lifestyle behaviors, which of course are the foundation and the most important, and then the supplements, which, you know, we can kind of add in, but are not going to be the whole picture. But anything else that we should talk about there as far as optimizing fertility, or things that you look for when you're looking for those root causes in women?
Yes. So I would say that, again, the second piece of this is to really understand whether there's the potential for hormone imbalance. And how do we do this? Well, for my patients, what I do is we do the deep dive into their history first and foremost, because they're the ones experiencing all of this. And so I'll have people coming to me and saying, you know, I'm feeling exhausted when I wake up, or I have a crash after each meal, or, you know, I'm experiencing hair loss. Or too much hair in parts that I don't want, or acne. So each of these suggests several different hormonal conditions, from potentially thyroid for some of the underactive thyroid, specifically for some of those first conditions I was mentioning, first symptoms I was mentioning, to potentially even, again, imbalance in male and female hormones, if there's a growth of hair in different patterns on your body, or acne on your face, chest, or back, right? So we start teasing that apart to say, okay, should we consider doing baseline hormonal testing? Because if there is an imbalance, let's work on, again, trying to heal this. And then not only that, I'm such a huge proponent of fertility awareness-based methods because they provide so many clues.
Information, yes.
So much information, right? Either from, if women are experiencing a very short post-ovulatory phase, and you wonder what's going on with the hormones, whereby it's not that classic and optimal, you know, 2-week period of time after ovulation before that next period begins. To bleeding in the middle of the cycle can suggest either structural or non-structural causes, to even having minimal cervical mucus potentially being associated with low estrogen levels, which can occur from either hypothalamic insufficiency, so an imbalance in the FSH and LH, or potentially even low egg number, as an example. And so learning a method for tracking these signs is something I encourage all women to do, regardless of where they are in their life. I think it provides a lot of insights. But I also want to tell people, because sometimes that can be a huge stressor, because they'll come and they're like, oh, I'm doing it all, but it's exhausting and I'm marking everything down. And so I tell people, you know, I want them to find a tool. There's so many different types, whether it be monitoring your temperature versus cervical mucus versus doing urine testing for the hormones actually in your urine. And so each person can really try different ones. There's a lot of wearable tech, which makes it easier. And I would encourage people that if they're having a hard time with one, don't feel like you have to keep doing it. Seek something else, or seek the assistance of a coach or of a physician who can help guide you through that. and there's some wonderful programs. So Fertility Science Institute has all the different types of methods, so people can kind of explore that and decide which one might be the best for them, for example. Yeah.
Yes. Oh, that's so amazing. And right, something that, again, I wish we were all taught when we were teenagers, because it's such an important insight into not just our fertility, but into our overall health. And like you said, this fifth vital sign that we can use throughout our lives. So I love that. So if it's, another way, if you are someone who's thinking about having children, it's another thing to think about, tracking in some way prior, so you understand what your baseline is like.
And also when you're ready, again, as we mentioned, it really provides natural ways to either avoid pregnancy, right? They're quite effective. They're quite comparable to condom use, or optimize fertility. So there are interesting studies showing using fertility awareness-based methods increases your per cycle chance of pregnancy by 10 percentage points, which is amazing, honestly. Personally. So lots of benefits either way.
That's incredible. Well, as we get close to wrapping up, I still would love to hear more. Even towards the beginning of the podcast, you talked a bit about the fact that people also have souls and emotional bodies and spiritual bodies, and we're not just the physical. And I'm so curious about how, because it's something that has become a bigger part of my practice in recent years as well. And I'm just curious how that comes into how you care for patients, how you support those aspects of their health, especially during, a time like this, which can be so emotionally draining for couples as they're facing infertility.
Oh, absolutely. I think that it's hard, and I say this all the time, but it really is profound suffering that people are coming to. It's pervasive. It just can very easily become the sole focus, understandably, because it's so difficult to be going through this and have that uncertainty of what's going on, right? And so, yes, I love leaning into those other aspects. I think it's quite important, not only because instead of the despair that many people may come into my office with, there is so much hope. This is clearly borne out by the literature. We know that ultimately, I know it can take some time, but over time, the vast majority of couples, to 95%, will conceive, will have a child. And that is encouraging. I know it can feel very scary. That we know that even in patients who have a history of recurrent miscarriages, the majority of them will have a live born baby. And so I always want to provide that hope. I think that is quite important. And I think, like you said, that we need to always remember that in these sufferings, it really is our opportunity to grow deeper in our relationships to each other and to God. So I'm a person of faith, and I think that I didn't focus on that as much, but that certainly was part of my decision to leave the conventional world behind in many ways. And that was, again, from just wanting to be able to focus on that more with my patients and hone in on that and understand that this is, again, an emotional and mental just struggle that people are dealing with, to the fact that I really believe that actually the data show that religion and having that connection spiritually extends our lifespan by an order of years, right? And so that's kind of an interesting concept, but we want to dig into that and hone in on that, and not forget that in our quest to try to correct everything, that again, we're not only made up of interchangeable body parts that don't have any other meaning, that we are human beings, and that this is an important part that has to be focused on. And so that mind-body medicine component, we really dive into when I'm with my patients and we're talking about that, we develop a plan that's going to work for that person, for that couple, so that they're able to focus on that. Yeah. Very
Absolutely. Yes. And I think such a kind of a beautiful place to be in this place of equal parts of like sort of surrender and like, okay, there's things that are outside of my control, but also there is a lot within my control, right? Like how I eat and how I rest and, the quality of my thoughts and all of these other things that we do have control over. But then there's also this part that, is so much bigger than us and that, we just have to trust a little bit. And I think the idea of childbearing can really, people can face that in a really big way because it can be so scary and something that we want so badly. And so if it's not happening the way we expect or the way we want, it can be really challenging.
Yes, that's beautifully said. Exactly. That's exactly right. And it really encapsulates. You're right. And that's what I tell patients sometimes is we're going to do everything in our power to optimize the things that we can control. But we know also, like you said so beautifully, that parts of this are not in our control. And so we'll focus on the parts that are. Yes.
Absolutely. Well, as we wrap up, there's 3 questions that I ask everyone at the end of the podcast. So the first one is, what are the 3 things that you do on a regular basis that have the biggest positive impact on your health?
Okay. So the 3 things that I do, pray, for sure. That I like is, just to continue that conversation
yes.
with God and really, remembering who I am and who He is, and how to be an instrument of His will in my daily life. So that's number 1. Number 2 is my relationships, and that's with my husband, and my family. I, am daily challenged and have just so much joy from being present for them and with them. So that's huge. And then obviously all my friends and the people whom I've been close to, it really provides such a source of, just love and support, right? And then the third thing I would say is to be out in nature and to, that is what I would, that's key. That's key. So those are the 3.
Yes. And so healing. What is one thing that you think would have a big impact on your health, but you just have a hard time implementing it or something you're working on?
This is easy because this is an active struggle, but it's sleep. Okay.
That's probably the most common answer I get to this one.
Oh no, I know. And I know it's so important. I talk to people about how important it is. And I always, think I better be, again, continuing to work on this and try to give myself grace when I fall off of it. It just feels like I don't have enough hours in the day. And so, being a mom and wife and having other things going on besides my career, sometimes I can't get to everything until after everyone's in bed. And then that is a disrupt. I'm not getting the full 8 hours that I need to be.
It's so hard. It's a constant struggle for everyone. I know.
Oh goodness.
And a great thing when you have so much going on in your life that you're passionate about that it fills so many hours, right?
That's true.
What about the third question is, what does a healthy life look like to you?
A life well lived. So again, a life rooted in faith, in who again we are as creatures in relation to God. It looks like a life. I think it's the life that in some ways, thankfully, I described, right? A life filled with meaningful actions and what you're doing, that you feel like you're having an impact on other people's lives and helping them. A meaningful relationship and group of others who you're journeying alongside with, right? And balance. Yeah, balance and peace. So it's a little bit non-specific, but I think that if we can achieve those, that's the goal, right? If we can achieve all those things, all these factors in our lives, then we're really how blessed we are if we can. Yeah.
Right. Absolutely. I love that. Well, this has been wonderful. I want to leave people with some resources where they can find you, learn more about your practice. Obviously, you're speaking at the upcoming FACS conference, but where else can people learn more about what you're up to?
Yeah, thank you. So the best way to reach me is my website right now, which is www.laurenrubalmd.com. And so that's LAURENRUBALMD. And so there's a way to contact me through there. And then, yes, a shout out to that conference. I'm really excited about hearing it because, yes, there's different approaches, so different techniques within that RRM umbrella. And we'll each be commenting on very common GYN conditions, from infertility to miscarriage to abnormal bleeding, and each providing our insights on how would we manage this if we were seeing a patient in the office. So I think it'll be really practically useful, and I'm excited to hear it from everyone else actually as well.
I am too, and it's great that it's virtual, so you don't have to travel. You can sign up. factsaboutfertility.org is the website, and they have scholarship options. So if you're a student, it should be easy to attend, and you get CMEs. So if you need we all need CMEs. So it's always good to get those too. But yeah, very excited to hear you speak, and others, like even Dr. Phil Boyle, who you mentioned from NAPRO, is going to be there, and others. There's, I think, a talk on FemTech as well. So it should be really great. And then you mentioned also for people who want to look into this approach, like let's say, just in general, they want to look into a restorative reproductive approach before going the IVF route. Where do you find other people who practice this way?
Yes. And so that is a great question. I would encourage people to look at different websites. So number one is that Fertility Science Institute. I think they do a nice job with all of the different methods. I would say that the Institute for Restorative Reproductive Medicine is another way that people can educate themselves. Facts About Fertility is wonderful, especially if you're a medical professional and are trying to understand this on a deeper level. They have a lot of information. And then finally, I really love Natural Womanhood. I think they do a great job for all people in different stages of our reproductive life. And I think they do it in a way that's really easy to understand and to read. So beautiful.
Wonderful. Well, thank you for sharing all those. We will link to them in our show notes as well. And just thank you for everything you're doing. I think one, it takes a lot of courage. I think for someone who, after taking this long path into medicine, and someone like you who's done residency and fellowship, it's a lot of time, it's a lot of money, it's a lot of effort. And you finally get to the peak, right? You're out there practicing and realizing, wow, maybe there's a better way I can do this. And it takes a lot of courage to sort of stick to your own truth and go that different route. And I'm always inspired by people who do that, and the ways that you then are able to really help your patients on a deeper level. Again, right? Getting to these root causes and connecting with them. And I even looked on your Google reviews, and patients just give you the most glowing reviews about, the ways that you're able to connect with them and be with them through their journey that often the conventional system doesn't really allow for, in terms of the time and all the other demands on doctors in that system. So just thank you for everything you do, and looking forward to sharing this and staying in touch.
Yes, absolutely. And let me just say just one last word. If there is someone listening who is in medicine and feels unfulfilled, I think that we both could say very definitively, do it. Yes. It's hard, but it's so worthwhile. I can't even imagine in my wildest dreams how wonderful I'm so excited to go into work. And in the sense of being able to really feel like I'm helping people on a daily basis. And so take the leap. So
yes, take the leap. It's worth it. And it's worth it. Reach out to us if you want a pep talk.
Yes, exactly. Thanks, Julie.
Thanks so much for tuning in. If you enjoy listening to the podcast, please consider subscribing and giving it a 5-star rating on iTunes. It really does help to get the word out to more people.